I just verified the patient using their full name and date of birth. I verified the orders in the patient's chart, and then I assessed the patient for pain. They don't have any pain at this time, so I'm not going to do any pain interventions. I'm going to do hand hygiene, put on my clean gloves, and remove the patient's old dressing. So I'm going to assess the wound, note any drainage, the amount, the color, if it has an odor. I'm going to look at the wound and any characteristics of the wound, like necrotic tissue, eschar. It looks good. So I'm going to dispose of this. And I would dispose of my gloves. And I'm now going to perform hand hygiene again. I'm going to position my patient in preparation for irrigation, make sure that they're comfortable. I'm going to get my irrigation tray. It is intact and not expired. So now I'm going to do my hand hygiene. So I'm going to do the irrigation with clean gloves. So now I'm ready to lay the drape down underneath the patient. So my sterile water is not expired, but it has been opened, so I'm going to lip it. I'm going to place the cap up and pour it into my container. Okay, so now I'm going to place this underneath the patient to catch the solution. And about 1 inch, I'm going to irrigate, going back and forth until the solution runs clear, which it is. So now I'm going to dispose of this according to facility policy. Also, after irrigating the wound, I would measure the wound or take a wound culture if it was necessary, but in this scenario it is not. So now I'm going to do hand hygiene again and set up my sterile field. So the packaging is intact and not expired. I'm going to put my drape down. And now I'm going to take the contents of the tray and place them in the middle. If I was going to be packing the wound, I would fill this with the sterile saline and the gauze, but I'm not going to. So now I'm going to put on my sterile gloves while keeping the sterile field in my line of sight, not taking my eyes off of it to maintain sterility. I'm going to put my sterile glove on my dominant hand first. And now I'm going to non-dominant hand. Okay. So now I am ready to dress the wound. I'm going to take some gauze and dry the wound after irrigation. And now I'm going to place gauze onto the wound. I'm also noting in my head the stage of the wound and if I had seen any tunneling or undermining, I would have made note of it as well. So now I am done with having to be sterile, but I now will tape the dressing. Make sure it's on securely. And I would label the dressing with my name, the date and the time. And then I would, following hand hygiene, I would document the procedure, how it went, how the wound looked, any wound assessments that I needed to document and make. So now the patient is dressed, I can take off my gloves and dispose of them. And perform hand hygiene.